Good morning, everybody. This is Heather Thomas with the Joint Information Center for Snohomish County's response to COVID-19. I'm going to take a few moments to click buttons to make sure that you all have permission to record. You will have permission to record this briefing, and we are also recording. The link to that video, as well as slides from today's meeting, will be posted on the Snohomish Health District's website later today. So give me just a minute. Okay, everybody should now have permission to record, but if for some reason I missed somebody, please go ahead and send a message through the chat feature to the Joint Information Center and I will get that fixed. We're joined this morning by Snohomish County Executive Dave Summers, Snohomish Health District Health Officer Dr. Chris Spitters, Snohomish County Department of Emergency Management Director Jason Biermann, and Amy Hill, Opioid Outreach Specialist with Snohomish County Human Services Behavioral Health Division. Each of our speakers will be giving an update, and after they've each shared their remarks, we'll take questions using the chat feature. Please be sure to submit your questions to everyone so that all of our speakers can see. Thank you again for joining us, and with that, I will turn it over to Executive Summers.
Well, thank you. Good morning, everybody, and thanks for joining us today. I think we're all excited about the prospect of the state reopening on June 30th. In addition, our county campus in Everett will be reopening on July 6th, more fully for services. So looking forward to that. Yeah, but we do have some concerns, continue to have some concerns. You know, we all know we've been through 4 waves of the pandemic, and we've beaten it back 4 times. We've got about closing in on 70% of our residents being fully vaccinated. So we're in pretty good shape to get this behind us, hopefully, but there is some cause for concern and pause and caution. There are new variants, as we have heard, that are circulating, and it's quite clear that they're circulating and affecting mostly folks that have not been vaccinated yet. So we can see some surges in that, and I certainly want to urge everybody to take the proper precautions so we don't go backwards and don't have to introduce new restrictions. So just use common sense. We're asking everybody that has not been vaccinated to please get vaccinated. We really don't want you playing Russian roulette with your health and those around you, so please. And also, the larger the pool of unvaccinated people, the more these variants can spread and grow. So just reducing that non-vaccinated pool of people is really important. If you have underlying health issues and or can't get vaccinated, please continue to wear facial coverings and all those safety precautions we've been talking. If you have children 12 or older, please get them vaccinated. We're seeing a lot of emergence of flus and colds and things in school settings coming back. So where those can spread, so can the virus. So please get your kids vaccinated. If you're going into a store or a restaurant and they ask you to wear a mask, please respect their rules. They're legally allowed to set those rules for safety matters. So we're pretty close to being out of this. I also want to mention, when we open the county campus, we will be requiring employees to be wearing masks inside unless they have shown proof of vaccination. So anybody in our county buildings that is not wearing a mask will have provided proof to the county that they have in fact been vaccinated. And we will be asking the public, if you have not been vaccinated, please wear a mask. If you have been vaccinated, you can enter the building without a mask. So those would be the rules. Pretty close to being out of this. Things are opening up. It feels great. We really need to celebrate that progress we've made and try to avoid a 5th wave. So let's get out and enjoy the summer, and our local businesses, restaurants, do it as safely as possible. So with that, I will turn it over to Dr. Spitters from the Snohomish Health District.
Thank you, Executive Summers, and good morning, everyone. I have just a couple of quick notes on the COVID front to add to Executive Summers' comments. Our 2-week case rate continues to decrease, currently at 69 cases per 100,000 residents through Saturday, June 19. That's a further decline, but like the rest of the state, our decline is starting to plateau a bit. The good news is there are now more than 400,000 residents over 12 years of age in Snohomish County who are fully vaccinated, specifically 407,000 through June 20. As Executive Summers mentioned, we need to keep up the progress with this vaccination effort as we move forward with the reopening. At the current level of vaccination, other countries have experienced, and modelers here in Washington State anticipate that if we were to fully return to pre-pandemic activity, meaning no social distancing and no mask use by anyone, regardless of vaccine status, we would indeed see increased transmission, hospitalizations, and deaths driven by transmission among unvaccinated individuals. And then we, as Executive Summers mentioned, the two variants that are now rapidly expanding, the B.1.617, also known as the Gamma, and the P.1, also known as Delta. Those two are more transmissible in the countries they originated from. They're also associated with more hospitalizations. And there's some reduced immunity in the test tube with these strains. So we haven't yet seen that play out in communities, but it's certainly the velocity with which those variants are expanding and combined with an incomplete, progressing and impressive, but still incomplete vaccination effort. We really need to rely on unvaccinated individuals to, one, get vaccinated, and two, mask up and maintain social distancing in public spaces until they are vaccinated. Today, we're also highlighting another epidemic facing the community for quite some time. While it hasn't had as much attention as COVID in recent months, there have still been teams and partners that have been continuing important work on opioid use and overdose prevention. It has been more than 6 years since the Health District and Snohomish County published the first report looking at heroin overdoses in our county. Since that time, both agencies have worked collaboratively to increase education, prevention, treatment, and connection to resources. To date, these efforts have focused on developing partnerships to have better access to data. When that first report was published in 2015, most data was 18 to 24 months old. Now we have the ability to track law enforcement and emergency medical service calls linked to overdoses and to the deployment of naloxone. Naloxone is the drug we administer to block opioids' effect and thereby reverse an overdose. It's a life-saving intervention in the majority of cases. Naloxone is also commonly known by one of its brand names, Narcan. We also have partnerships with Providence Regional Medical Center, Everett, and Swedish Edmonds to get information on overdoses being seen through their emergency departments. The Washington State Department of Health has also made investments in their systems for detecting opioid overdose diagnoses in emergency departments and hospitals. The Snohomish County Medical Examiner's Office upgraded their database to support this effort as well. This means we now have access to overdose and fatality information related to opioids within 2 to 3 months of occurrence, rather than the 18 to 24-month delay we used to have to accept. Now I'm going to share my screen and go over a few data points that provide a snapshot of the ongoing opioid epidemic happening here in Snohomish County. On this first slide, you see trends of overdose deaths by drug type. So these are the purple bars are prescription opioids, the green bars are heroin, The blue-green or teal bars are synthetic opioids, and then this line across the top is the total of all opioids, of all 3 bars added up. So in 2011, as we saw the prescription opioid epidemic expanding, pharmaceutical companies changed the formulation of prescription opioids to be extended release, and thereby partially reducing their abuse potential. And then for healthcare practitioners, prescribing of opioids became more regulated, and a lot of continuing education went into more judicious use of opioids for treatment of pain. And you can see from that point forward in 2011, the purple bars decreased, showing a decline in prescription opioid overdose deaths. Unfortunately, over time, that was replaced by an increase in heroin overdose deaths, which was cheaper and more readily available for those with substance use disorders who were no longer able to get prescription opioids being used to avoid withdrawal and to address cravings. In recent years, we've also seen a disturbing increase in the prevalence of synthetic opioids, these blue bars, really a quite dramatic increase over the past few years, which are predominantly fentanyl and fentanyl analogs. Fentanyl is a very potent opioid used in surgery initially, but now it has become a street drug, and it's also synthesized illegally and can be sold and purchased on the street. So these drugs, these synthetic opioids, are used for their effect to get high, to relieve cravings, to relieve withdrawal symptoms, but also sometimes people think they're purchasing other drugs like tranquilizers or psychoactive drugs on the street, when in reality they're laced with fentanyl, and so that increases the risk of overdose there. As you can see, fentanyl-related deaths have increased dramatically, with preliminary numbers for 2020 last year showing 126 deaths linked to fentanyl, more than twice what it was just 2 years prior. We also just received updated data from the Washington State Department of Health yesterday, which sadly shows preliminary numbers for 2021 following the same increasing trends. This is just year to date, and I would say is incomplete year to date. This is probably just Q1. So if you multiply that out roughly times 3 to 4, you can see we're gonna be up here for the year if things don't turn around. I'm going to go to the next slide now and show you another way to look at the data we've been seeing for the past few years. As we had heard anecdotally last year, the data does show an increase in opioid-related overdose deaths here in Snohomish County, especially in the latter half of 2020. So going left to right, each year we have a column, all drugs. That includes opioids and non-opioid narcotics. All opioids, and then the subsets of opioids I was addressing on the previous slide. It's also important to note that most overdose deaths involve multiple substances, such as, in addition to opioids, cocaine, benzodiazepines, and psychostimulants like meth. This next slide is a look at the use of naloxone, Narcan, the overdose reversal agent, by law enforcement and emergency medical service providers when encountering overdose victims at the scene of the overdose. The majority of these represent lives saved thanks to the widespread availability and training in the use of it, of naloxone. And I know Amy will be sharing more about that in just a few minutes. But you can see at least 150 to 200 uses in each quarter of each of the past 2 years. The last slide, I want to show you some data from Providence Regional Medical Center in Everett and Swedish Edmonds. These are combined data from both hospital emergency departments showing the number of opioid-related overdoses seen in their ERs. So these don't have to be fatal overdoses, just any overdose. And they show each quarter of the past 2 years, 2019 in blue, 2020 in red, and then the first quarter of 2021 in green. And again, you can see we're up early this year, and for most of the quarters last year, 2020 increased over 2019. With these increasing numbers of overdoses and opioid-related deaths, there's a lot of work ahead of us to prevent initiation of opioid use in the first place, to help those misusing it to stop through evidence-based methods like medication-assisted treatment with buprenorphine, and to prevent deaths due to overdose by making naloxone widely available. We are grateful to have the partnerships represented here on this call, as well as funding and technical support through the Centers for Disease Control and Prevention, HRSA, the Health Services Research and Services Administration, the State Health Department, and the North Sound ACH, helping further this work. To share more about what the MAC group has been doing, I'm going to turn it over to the county's Director of Emergency Management, Jason Biermann. Jason?
Thanks, Dr. Spitters. Good morning, everyone. I have just a couple of brief things to add. And appreciate Dr. Spitters giving the data. As he mentioned, this epidemic has continued and in some ways seems to have worsened throughout the pandemic. From my perspective and from the emergency management system perspective, it was something we were actually dealing with long before the COVID pandemic started. So most folks may recall that in late 2017, Executive Summers partially activated our emergency management system in response to the opioid epidemic, and with other local leaders and members from agencies, including the Sheriff's Office, the Health District, and our Human Services partners, we stood up the Snohomish County Opioid Response Multi-Agency Coordination Group, which you'll hear me refer to and others refer to as the MAC group. We've continued actually throughout the pandemic to keep that group activated. Its continued activation goes on, and we had a meeting yesterday with the group. That group's work is really focused on getting all of us coalesced around goals and objectives, which is how we respond to all types of disasters. And so that system actually informed some of the work that we were doing with the pandemic. So some of the opioid response work actually informed some of the things that we did during the COVID pandemic. Many of the people who were working with us during the opioid response transitioned into working with us with the COVID response. There are some specific lessons that the opioid response informed with the COVID. One of those was mentioned, a prominent one being the data mining. We had an opioid data collection group that we established so that we had a more holistic view of the impact of opioids on our community. We were able to work with local EMS providers, law enforcement, the healthcare system, and our dispatch center so that we could mine data in real time to give us alerts. For example, the increased number of falls, that was something we had looked at as it related to opioids. That then became an indicator we could also apply to COVID infection outbreaks. So that data collection was one example of some of the lessons we learned from the opioid response that we applied to the COVID response. We also implemented what we call safe teams during very early in the COVID pandemic. Similar to the outreach that's done with folks in encampments around opioids, we use geospatial data mapping, GIS capability that was developed to track homelessness, and applied that to the safe teams that went out so that we could touch base with folks who were unsheltered and provide them education, COVID screening, and other things, other services that they may have needed once COVID really took hold of within our community. And so as we go forward, at least from the emergency management perspective, as we go forward with COVID and it sort of enters another phase with, as Executive Summers and Dr. Spitters said, the case counts tailing off a bit, still a need for vigilance, but with that happening, the opioid MAC group will continue. We'll continue to do this work because, as you've seen with the data, that work is still very necessary. As I mentioned, we met yesterday with many of the partners to identify strategies and look at the goals and look at how we refine our goals around the opioid work, how we can incorporate any of the lessons learned now from COVID to apply back to the opioid epidemic. And just overall, Dr. Spitters mentioned partnerships. So as we were tackling opioids, as we've been tackling the COVID response, and now as again, we place greater emphasis on the opioid response again, we'll continue to do that with innovation and collaboration. And I think that's a really important aspect of our community and the way we respond to these crises. Lots of partners that are involved in that. One of them, Amy Hill here from our Human Services Department, who've been a great partner in both the opioid response and the COVID pandemic response. And so with that, I'll turn it over to her to give more details on the human services aspect.
Thanks, Jason. Good morning. Happy to be here. Snohomish County Human Services, we're getting ready to launch our annual opioid awareness campaign. We're going to focus on 3 areas this year. Number 1 being the dual pandemic. The impacts of COVID-19 have exacerbated the existing opioid crisis. As you could see in the slides that Dr. Spitters shared, opioid-related deaths have nearly doubled between 2016 and 2020. Also talking about the fake pills awareness is something that we're also focusing on. They're due to the increase in fentanyl overdoses and deaths in Snohomish County. It's important to get the information out there to people to let them know that counterfeit pills can look legitimate. They look real. It's hard to tell the difference. And with fentanyl being a synthetic opioid that's 80 to 100 times more powerful and stronger than morphine, even a tiny bit of fentanyl can be lethal. It's important for us to get the information out there that we do not want people to take pills that they did not directly receive from their provider or their pharmacy. Because like I said, there are pills out there on the streets right now that are killing people, and a lot of transition from heroin use to the fentanyl pills is what I'm seeing with the clients that I work with. The third focus is going to be youth and young adults. Overdose is reversible, but death is not. We need to have people know the signs and be able to save a life. Dr. Spitters spoke a lot about the naloxone and Narcan. One thing that I have the privilege of being able to do for the county is provide Narcan trainings in our communities. Prior to COVID, I was able to do it in person, usually about 4 or 5 times a year, and people would come. We were really lucky to have CHC, Community Health Centers, provide Narcan that they donated to people who attended the trainings. So everyone who attended the training was able to leave with Narcan and be equipped to save a life. Focusing on the youth and the young adults, it's really important that opioids are locked up and put away if they're in the home. You know, if you're going to use, we say do not use alone. You cannot use Narcan or naloxone on yourself if you're experiencing an overdose. So it's important that we get this information out, that we want the youth and the young adults to know that the dangers with these pills that are out there, and to be made aware of that. So anybody can carry Narcan or naloxone. Anyone can get naloxone in our state without a prescription from a pharmacy. Can visit www.stopoverdose.org, and you can find what pharmacies provide the naloxone kits. We also are going to be providing another training. We did one in May in East County where we did a hybrid Narcan training for a small amount of people in person, and then provided Zoom for people be able to attend virtually. The next training will be coming up in September, and usually it's on Eventbrite, where people can look for the next training, the upcoming training, and to be a part of that. So hopefully we're going to be able to continue to get the information out there, that Narcan is available for people to carry. Again, just to reiterate that these fentanyl pills that are on the streets right now are deadly, and we want to avoid people taking them. Additional information for training information, you can contact me at the Human Services Behavioral Health, and I'll just provide my number is 425-388-7209, and I'm happy to answer any questions in regards to this. I think that's it for now. Jason, or excuse me, Executive Summers, if you want to take it back over.
Great, thank you, Amy. Thanks for that, and all your hard work. Very, very much appreciate it. A lot of other people too, Jason, and Health District and so many other. It has been a partnership, so we'll keep going on it. So first question, over the last couple of weeks, there's been questions about whether the lottery has made any impact on getting people vaccinated in the county, and so far there hasn't been any impact. Department of Health is saying statewide that there has been a positive impact. Why do you think the incentive isn't causing people in Snohomish County to get the shot? Is there a disconnect between the county and the state in any way? I think we kind of addressed this last week, but I think it's not accurate to say there's been no impact. I suspect that there are individuals perhaps many that were influenced by that. We just didn't see a huge spike or wave, as far as I know, in the data. But and also the lottery entry was also a reward for people that had already been vaccinated. So I know I was vaccinated before this was announced, but I'm in the lottery too. So there's both a reward and an incentive built in there. But Dr. Spitters, you have any other information on the effect of the state program?
Well, same conclusion, Executive Summers, that I don't think we can say it hasn't worked. We don't have what's called the counterfactual. We don't have part of Snohomish County randomly operating without the incentive so that we could really compare. Who knows, maybe without the incentive, we would have seen things continue to decline. Whereas what we saw when that announcement was made, a very slight bump upwards, and then a leveling off, a smaller, bump up than the state saw and most counties. But so there's that. And then, yes, we do get calls and emails and Facebook posts from people asking about, are they going to qualify for the lottery? So we know that there's interest out there. And then independent of all that, we're still hitting 25,000 doses a week. So lottery or no, progress continues to be made. And that's really our goal, is to expand coverage of the vaccine.
Next question. We've heard from viewers that it's becoming harder to get a COVID test than the vaccine at this point. Are there places they can get tested without large wait times? Where should people turn to get tested right now?
Well, yes, our sites are appointment recommended. We have testing sites at the every day of the week at the it's called the Longfellow Annex, in that same campus there where Memorial Stadium and Funko Field are. There's still a testing site there. I think we have testing going on periodically, not every day, at the Linwood Food Bank. And we are in the process of, or already have looked at closing down our other sites. But that being said, you can show up there without an appointment. We just prefer one. You can get results in 1 to 2 days. And then the healthcare system is still set up for testing as well. So we just didn't have the volume of testing occurring to merit maintaining so many days and sites open. There was just no economy of scale. So we've contracted. You can still get a test through the health district, but you can also get one through the healthcare system. Virtually all community clinics and medical groups are still offering testing for COVID.
Thank you. Next question. Some people will choose to continue to wear masks as restrictions drop. That it's their choice, obviously, but others have vigorously opposed masks. How do we keep the debate civil as we reopen? So we're asking and instructing our employees not to challenge people. And it, again, like through this whole pandemic, we're really relying on the sort of common sense and goodwill of the public to do the right thing. So I think we're going to have some bumps and some incidences. We've seen that around the community, but for the most part, it's been manageable and not too big. So I think as time goes on and people get used to both seeing masks in public as well as not seeing masks on other people, I think that'll sort itself out. But don't have anything more than that. You know, many countries, particularly in Asia, where I've seen that masks are actually commonplace during flu seasons and cold seasons. And I think that's probably our new normal here. So we'll over time get used to seeing sort of mixed in public. So Dr. Spitters, any further thoughts on that?
No, I think you've got it, and I agree. I think that face coverings in the future during flu season, COVID or no COVID, or high COVID or low COVID, is probably is part of our new normal. And you know, we can only control. You know, keep our eye on what we can control in terms of being civil. And if you feel you're in a setting that, hey, it's too crowded and there's too many people not wearing masks, I can't believe all these people are vaccinated, well, then get out of there. Yeah.
So with the Gamma and Delta variants considered escape variants with vaccines slightly less effective against them, why not just keep stronger mask rules in place to be safe, especially since we've seen the Delta go hog wild in places like the United Kingdom? Dr. Spitters.
Yeah. Well, these are all policy decisions based on risk benefit, cost benefit, and you know, the clinical effectiveness of the vaccine against these variants, although the in vitro or test tube effect of antibodies from recovered cases or vaccinated individuals is less potent in neutralizing these viruses in the test tube, we still see good, you know, reasonably good efficacy against infection and still very good efficacy against severe disease on a community-wide basis. And because our focus is to interrupt the emergency and the grip that the virus has had on our society, you know, we've got to go the route that is most efficient, and that's coverage. So it's been shown that if you have, so as you say, let's say there's a little deficit in efficacy against these variants of concern, well, then the response to that is to expand vaccine coverage. And I think that, you know, adding mask wearing by folks who are already immune, certainly everyone's free to do that. And if because of medical conditions or personal preference, you know, risk aversion, people want to do that, that's great. And they can and should continue doing that. I just say that's more out on the flatter portion of the effort reward curve. And where we really can get a lot back for effort is in continuing to expand coverage with vaccine. As Executive Summers mentioned earlier, the fewer infections we have, the less source there is for transmission, and the smaller the pool of viruses out there in the world from which further variants can emerge. So get vaccinated is really the punchline to all that.
Okay, and Dr. Spitters, say there's a plateauing of cases. Do you fear the June 30th opening will potentially lead to more or an increase?
Of course, I mean, I don't know that I fear it. I do fear things getting out of hand for some reason. If let's say a variant or the two variants combined with, you know, just too much exercise of liberty by unvaccinated folks leads to another wave of hospitalizations, I think it's conceivable, and that's why we're here talking to you about it. And so it's really in our hands, though, between the vaccine and appropriate use of masks and social distancing by unvaccinated individuals. We have the tools to avoid what you mentioned. So I share your concern, and I encourage you to broadcast that to the community.
And is overall testing down considerably now that so many people are vaccinated? Is it an issue to have fewer people getting tested?
Well, we certainly want access to testing for the following reasons. One is just case finding. People who are sick can and should go get tested, so that, and meanwhile, maintain isolation from others. And then if they're positive, continue that and follow up with the health district for the contact investigation. So that's a key thing. Another reason it's out there, not as much for individual health or sort of micro community health, but at the macro level, it's a tool for us to detect increases in transmission. For instance, if we see positivity rates taking off, which usually they do in sync with increases in case counts. So it's also a surveillance tool for us to detect increase in transmission early. And on the other hand, demand is down because transmission has been down. And we were running about 10 to 12,000 tests a week there at the peak of that fourth wave. Now we're down off 2/3, half of that. But it's because there's just fewer people seeking testing due to illness. And so that's just the way it is. But what your point speaks to the importance of us maintaining low barrier access, both as a means for case detection, as well as for an epidemiologic tool to send a signal to us in the community that there's increased transmission.
I think that does this.
Great. This is Heather Thomas with the Joint Information Center. Thank you again for joining us today and for all your questions. We're going to wrap up for today, but please stay tuned for future media availabilities. Thanks and have a great day.